My name's Simon Harris. I'm Managing Director for DHU Healthcare CIC. I've previously worked in commissioning organisations, and then I moved across to this organisation to get better contact and closer to patient care. Previously, when you're commissioning, you can make a real difference, but actually when you work in a provider organisation, you're far closer to patient care. You can see the real impact and differences that it makes when you make decisions, I guess, and influence operations and service delivery. Well, the most challenging part is the transformation and the expansion of the services. Prior to me starting 12 months ago, the services were we had around 200,000 patient contacts a year. Now we're at just under 500,000 patient contacts a year, both face-to-face and telephone advice. So that's created significant challenges in terms of increasing of the staffing and the workforce and the transformation that's needed to get up to that point. Yeah, the most significant digital achievement over the past 12 months has been the project that we're talking about today, which is Skype for Business, where we have GPs talking to patients in care homes, getting that face-to-face contact in a virtual way over the video link, instead of the patient having to either come to the doctor or the doctor going out to see the patient. That's probably one of the most biggest transformations that we've achieved in the last 12 months. Yeah, we brought this change about actually to make it quicker and easier and more convenient for patients, but also to enable GPs to see more patients. When a GP goes out to do a home visit, whether in a care home or in their own home, the average call cycle time is about an hour from the GP leaving the base, going to the patient's home and then going to the next base. If they can do it via video link, actually it can take between 10 to 15 minutes. So in that space of an hour, the doctor can see 4 patients, and also importantly it's more convenient for the patient, who can stay in their own home. The benefits are there can be a significant cost saving on the NHS and the taxpayer, which is really important. Financially, everything's very tight at the moment, so if we can save funds, that's really advantageous for patients. And importantly, if we do save funds in year, we can reinvest those funds back into the frontline services by purchasing more hours for doctors and nurses and paramedics to see patients. I would say the largest barriers to achieving digital transformation are probably the people themselves and the resistance and to change. That's often a barrier in itself. I think what we've done locally is push and drive forward transformation, certainly digital technology, so people embrace it, but it can sometimes be a barrier at the same time. Yeah, so I think the biggest challenges that we face is interoperability of the systems and all patient records. Because I think when a patient presents to a clinician, they fully expect that clinician to be able to access and see their record in its entirety to make an informed choice, an informed decision about their health and social care. And unfortunately, at the moment, that's not fully interoperable amongst all services across the whole health and social care spectrum, particularly in social care, which is an equally important aspect for healthcare, certainly for elder people as well. Yeah, and I mean, my advice would be that this works. It's making a real difference and positive impact on patients in their own homes. And if anybody wants any help or guidance or support, we're very happy to help them. We deliver out-of-hospital services to all of Leicestershire, Leicester City and Rutland, and we're very happy to help if anyone wants to make contact.